Hi, everybody. This is David Nevins for CityBiz, and welcome to our program today. And today, our special guest is Jorey, and Jorey is the CEO of the Immune Deficiency Foundation. Jorey, welcome to our program.
Thank you so much for having me. I'm excited to be here.
Well, it's our pleasure indeed. And so I know a lot of people will have questions as to what is the Immune Deficiency Foundation, but let me also start off by mentioning and then asking you that we are speaking this week, which is World PI Week, and that's time to raise awareness around the world of primary immunodeficiency. Quite a mouthful. So let's start with your telling our audience what is PI and how many people are impacted by it, and a little bit about what your organization is doing to help the cause.
So you could not be more right. April is PI Awareness Month, and World PI Week is from April 22nd through the 29th. And just as you said, this is a unique opportunity to raise awareness for primary immunodeficiency, which is it's a mouthful. I might use PI a little bit later, and really to help us achieve our goals of early diagnosis and access to timely treatment for not just people in the US, but for all over the globe. So a really quick primer on PI, and again, easier to say than primary immunodeficiency, just to kind of level set. PI is an umbrella term. It represents more than 450 rare, chronic, genetic conditions where someone is born actually missing part of their immune system, or their immune system doesn't function properly. They can affect anyone, any age, any gender, any ethnicity, but no matter what specific type of PI condition that someone has, they all have one thing in common. The body cannot fight infection, or it can't fight it very well. Our community fears infection pretty intensely every day for the rest of their lives. But even, I always remember to say this as well, even beyond the physical implications, we could just take a moment to imagine the toll on your quality of life to be sick over and over again with what can be severe, persistent, maybe unusual, recurrent infections that not just for sometimes months, but even for years on end. And there are sometimes no answers in sight as you navigate, let's face it, a complex healthcare system. The impact on a person's mental health is really significant. So just a couple of things about PI, I'll tell you a little bit about the Immune Deficiency Foundation. So when you have a PI, again, a primary immunodeficiency, you can feel scared and isolated, overwhelmed, really unsure how to navigate living with your diagnosis, because here's kind of an added issue. In addition to your condition being rare, meaning it's very likely nobody in your life has heard of it, it is also often invisible. And that can make you feel alone, ignored, or vulnerable. So that's where the Immune Deficiency Foundation comes in. Tens of thousands of people turn to us for trusted information and answers. Our website is one of the first places that people will turn to. We also have an Ask IDF feature that allows people to get their questions answered one-on-one. We work with leading immunologists across the country, so you can trust the science and the research we share. We also offer robust virtual and in-person educational opportunities. And these are rare conditions. So we work to provide opportunities for people to connect with each other, so that they have a shared experience or facing similar challenges.
So yeah, I mean, it's really fascinating, and I know you do amazing work. Just give us again a sort of a quick nutshell of maybe a little bit about the history and a little bit more about the mission of the Immune Deficiency Foundation that you head.
One of my favorite things to talk about, so I absolutely will do that. Like many patient advocacy organizations, the Immune Deficiency Foundation came into existence because of a commitment that stems from not wanting other families to have gone through what one family did, and seeing a need and stepping up to respond. So we were founded in 1980. It's a little over 43 years, coming up on 44 years ago, by a mom who had a young child with a serious and rare condition, a primary immune deficiency. And she realized as she searched for information, as any parent would, that there really wasn't an organization you could turn to for resources and support for those who were impacted PI. And this is my favorite piece of this. The Immune Deficiency Foundation was born by a mother at a kitchen table. So every organization has a mission statement, as do we. They can be just words on paper, or I'm dating myself a little bit, words on a website, but I promise they're not just words on a website for us. Every day, a small but incredibly passionate team, I would argue, wakes up with one goal in mind, and that is to improve the diagnosis, the treatment, and the quality of life of every person who is affected by primary immunodeficiency. And the way we do that is by fostering a community that is connected, engaged, and empowered through advocacy, education, and research. And the reason why that's important to us is we have a pretty bold vision, and our vision is a healthier day every day for every person with immune deficiency.
And I know that in recent years, in particular, you have particularly following the pandemic, you have really built the organization's reputation and really helped families post-pandemic and during the pandemic deal with a lot of the increased issues, I guess I would say, that they have had as the result. Tell us a little bit how you made that happen.
Well, first, thank you for acknowledging that. And it's really kind of you to say. And yes, since our founding, we really built our reputation on providing the most robust, patient-centered, and I would say fact-based information on PI. In fact, I am proud to say that our materials have been translated into more than 20 languages and are used all over the globe. But it's always been a bit of a niche audience. People only knew to seek out that information once they already had a diagnosis of PI. But the pandemic changed all of that. Early in 2020, we found that Ask IDF, I mentioned that before, that's kind of our information hotline, so to speak. It was swamped with people seeking whatever information they could find on COVID. And it wasn't just people with PI. It was older Americans who felt vulnerable to infection. It was people with autoimmune conditions like lupus. It was families with a relative undergoing chemotherapy. But they had one thing in common. They were worried about their immune systems. And we, as the Immune Deficiency Foundation, we took that responsibility really seriously. We started writing articles about what we knew. We hosted information webinars to answer questions. We reached out to the CDC on behalf of our community, and a physician on our board of trustees began creating videos to explain what was happening, and those videos were getting tens of thousands of views every day. So we could see that there was this need that just wasn't being filled. So late in 2020, we launched the Immunocompromised Collaborative. It's a coalition of organizations that serve patients with compromised immune systems. This coalition really jointly represents 9 million Americans for whom the COVID vaccine just wouldn't be enough protection. And so together, this coalition, all of us that the Immune Deficiency Foundation was leading, we were able to see so many successes. Monoclonal antibody treatments, additional protections for the immunocompromised, expanded telehealth options for medical care. Those are just a few.
So obviously the organization's been growing, expanding. More importantly, your impact has been quite clearly growing and expanding as well. And I know you have a big PI conference this summer in Chicago, if I'm not mistaken. Could you tell us a little bit?
I couldn't help but smile when you said that, because that's my second favorite thing to talk about.
Okay, well, I'm going to give you an opportunity to talk about that, please.
So we are so excited, and I'm just representative of the rest of our team. We're so excited to have our first in-person conference since 2019. So the first coming back post, I guess, post-COVID or post the height of COVID. It's going to be an incredible event. We're featuring world-class speakers. There are going to be unprecedented opportunities for connection, and it's going to be a real, which I love, celebration of the PI community. We also, and this is huge for us, are going to have the world premiere of our feature-length documentary, Compromised. We wanted to really remove any barriers to participation. So we provided almost 400 travel scholarships covering hotel, airfare, things like that. And we're expecting total participation. So patients, caregivers, speakers, exhibitors, to total about 1,000 or more. And the reason why that's important to us is providing this conference is really core to our mission to foster that community that is engaged, connected, and empowered, and in this case, through education.
And let me just ask you, so I don't forget later, how does one learn more about the conference and potentially to attend and participate?
Well, we have a very easy way that you can find everything that you need to know to register for it, to also learn more about the Immune Deficiency Foundation. And you can just go to primary.immune.org, and front and center, and that's our webpage, front and center on the homepage. One of the obviously key things that we're highlighting right now is our PI conference. You can click there and get all the information that you need.
So it sounds excellent, and I hope to actually check it out and potentially be there myself. So I know, besides the conference, now I'm going to bet that I'm asking you about your third most favorite thing to talk about. I know I'm going to take a risk and take a guess that might be so, but I know you do these walks all over the country to both increase awareness and raise money for the Immune Deficiency Foundation. Tell us a little bit about that as well.
Well, you hit the nail on the head. A couple I love talking about walk, and that is one of our 3 main goals. So 3 main goals for Walk for PI: engagement with our community, spreading awareness about what PI is, and raising funds for the mission. We had some record-breaking participation at some of our walks last year, and of course, we want to bust those records and grow participation at other sites as well. So we are hosting 8 in-person events across the country, and I do have a little cheat sheet so that I don't miss them. Boston, Charlotte, Dallas, Milwaukee, Philadelphia, St. Louis, San Francisco, and Tampa, but we're also hosting a virtual walk for those who can't make an in-person event, or if there's one not, obviously not near you. And our 2024 walk season has officially kicked off. You can find, and let me give you another website. You can find out more about, how to register, how to become involved at walkforpi.org. So walkforpi.org. We encourage anyone who's interested to be a walker, a supporter, a sponsor for Walk for PI, and anyone. I always share this fun fact. Anyone that has been to one of our walks, or even checks out we talked about the Immune Deficiency Foundation website, you'll see zebras everywhere that you look. But many in the rare disease community identify themselves as zebras. And there is an interesting reason why. Some of the viewers may know, you may know, but if not, it was a common saying in medical schools that when you hear hoofbeats, think horses, not zebras. Meaning, when making a diagnosis, think of the likely ones, not the rare ones. But if you have a rare condition like PI, you're a zebra. So our walks are the perfect opportunity to get, we call them, our herd of zebras together to create awareness and raise funds.
Good for you, really good for you. And then beyond the walks, I know you also have a number of other mission-driven activities that benefit the foundation. Please share.
We certainly are focused on our Walk for PI events, our educational events, our documentary. Those are all important deliverables for our community. But there are other strategic priorities that we're focused around just internally within the organization: shortening the time to diagnosis, increasing access to treatment, and improving health equity for those we serve. So just a little bit about those. a lot of our awareness efforts with the general public and especially with clinicians, it's all geared towards shortening that time to diagnosis. The sooner, as you can imagine, the sooner individuals can be diagnosed, the faster that they can get treatment. We also are heavily involved in advocacy at both the state and federal level. The majority of our patients utilize a plasma-derived therapeutic. Here's a bit of a mouthful: immunoglobulin replacement therapy. So it's very important to us that they have access to their treatment, and also that they have as many treatment options as possible, and that there is a stable supply of plasma donations. So that could be legislative or regulatory policy. It could be health insurance issues like barriers to coverage of treatment or banning copay accumulators. We even advocate for funding for PI research at the federal level. All that's to say, advocacy is one of the 3 pillars in how we fulfill our mission. So it's vitally important. And then our priority around health equity really touches those other strategic priorities: reducing the time to diagnosis, and in particular, trying to reach the undiagnosed, and access to treatment. I love that we did this last year. We launched 2 special podcast series. The first one was called, and it's still going on now, Undiagnosed. It chronicles the long journeys to a diagnosis. So each episode is sort of a deep dive into one individual journey. It's an audio narrative. It has something that our listeners have found to be very compelling. It's a bit like a mystery diagnosis. It has that kind of feel to it. The second podcast is Bold Conversations. That takes a look at health disparities and social determinants of health. And what our goal is that we hope listeners walk away understanding why health equity is important, but also just really how it affects all of us. And all of this will support our diversity, equity, inclusion, and our health equity strategic priorities. It's all meant to make our resources and our education and our information more accessible, and the PI community we reach more inclusive. It's really kind of meant to help us break down barriers, whether they be language barriers or financial barriers. I mentioned the scholarships earlier and getting people to our conference. And we really hope that it will help our clinician education awareness goals, with the ultimate goal of reducing the time to diagnosis, because PI is so rare. Many clinicians, physicians, those healthcare providers, they don't even consider it as a potential diagnosis. That's the whole zebra conversation we had. So we work really hard to reach out to what I guess we would call immunology adjacent specialties. So think just even outside of immunology: dermatologists, oncologists, rheumatologists, hepatologists, so they can be aware of the signs and symptoms of PI. And we are hoping to meet communities where they are. We're really focused on building relationships with organizations who represent and serve diverse communities. That's a priority for us.
Well, you are an incredible spokesperson for the cause. We only have about a minute or so left. I want to switch gears for a second, Jorey, if you don't mind. And I know that your organization is, I guess I might say, quote unquote, based in the Baltimore, Washington area. And you're speaking to us, correct me if I'm wrong, from your home office in Texas. And you have somehow very successfully made this organization into a very efficient yet fully remote business. Given the fact that this particular program, City Biz, is watched by business and civic leaders all around the country, just give us a couple little, I guess I'll call them management tips on how you've been successful, very efficiently running a fully remote business, which wasn't fully remote prior to the pandemic.
It wasn't. And yes, I am speaking to you from my office in Texas. If you can't tell by the accent, I also live where the accent was born and raised. We're based in the mid-Atlantic, but we do have a hub office, in the Baltimore area. And yes, we are a fully remote workforce. We are spread across 13 states, but being remote can work. But you have to be intentional about the moments you do come together in person. I made this mistake. The first few times we did that, I filled our in-person team meeting agendas with training and presentations. And really what the team wanted was a good portion of the time to be devoted to departmental and team meetings and to spend time in small groups. So we all convene in Maryland at least twice a year. It's a time investment for our staff with travel. It's a financial investment for the organization, but it's absolutely a necessity for us. And I feel, have become pretty proficient at being a highly communicative team. We had to become really comfortable with technology and all the opportunities it provides us. We want to create that environment where when we have a video call, it feels like you popped your head into the office next door. But here's the last thing I'll say about it, more so than technology and getting the agenda right when you bring people in person. Ultimately, in my role, I have to lead by example. And I choose to lead with trust. So let me reiterate that. It's a conscious choice. I choose to trust people are doing the right thing, even when I can't physically see them. And I have to assume positive intent. And 99% of the time I'm right. And unfortunately, when there's a time when I'm not, it's pretty obvious. So being a remote workforce has helped us in we have to work at it, but it's also an added benefit, broaden and diversify the pool of candidates for roles that we have in the organization because we're not bound by geographic location. So I think it benefited us.
Good. So in closing, you've already talked a little bit about how people can reach out to you, but I know you have something about which you're very proud, I believe, a brand newly designed website. So tell us how people find that, and then just tell us a little bit about your new website as well.
We launched it last fall. I mentioned early on, it's one of the first places that people will turn for answers and resources or to access information. It's modernized. It's easy to navigate. It's an easy to navigate online experience. And it's not just for those diagnosed, but also for those yet to be diagnosed with PI. And especially our communications team, but we're all so thankful that the overhaul is now a reality and you can go right now and find it, primaryimmune.org.
Jorey Berry, thank you so much for being with us today.
Thank you so much. It was a pleasure.
It was our pleasure. And please check out the Immune Deficiency Foundation. You'll learn about things that you were likely unfamiliar with, and they're really helping the world and certainly helping patients who have this diagnosis. Again, Jorey Berry, thank you for joining us, the CEO of the Immune Deficiency Foundation. And this is David Nevins for City Biz. Thank you for watching.